Okay, so thank you very much for the introduction. So I'm just going to show you some of the advancements we've made in the international FAO antimicrobial resistance monitoring IT platform and system. This is one of the key deliverables that are also under the ACT project. Is the mechanism we are also going to be using at the global level to support the implementation. I'm not doing this, but one second. Okay. To support the implementation of the Codex guidelines for integrated monitoring and surveillance of foodborne AMR. So hopefully we can bring more clarity on how we are going to articulate this collaboration and this mechanism for implementation at the national level. So just to start with a short introduction, something is wrong because I'm not touching anything and it's moving along. Okay. Just to start with the introduction. So as you know, we are operating, all the FAO activities are operating under the FAO Action Plan on Antimicrobial Resistance. This action plan is covering the period 2021-2025, and this is the roadmap coordinating the efforts of the organization in the implementation of activities. So we have 5 objectives. Among these 5 objectives, one of them is strengthening surveillance and research. And I'm going to focus on this. For this, we have 4 main mechanisms to deliver on this objective. One is to deploy tools for capacity building on surveillance and laboratories in the field. We also do field interventions, collecting samples, doing antimicrobial susceptibility testing and pilot studies. We also provide access to resources and technical networks. And then one of the things that we are including in this new action plan for this, something is wrong. One of the things we are including in the action plan is strengthened support for data collection, management, analysis, visualization, and dissemination of the data. This is something new compared to the previous action plan, because now we are giving more emphasis to the use of the data produced from the laboratories. So we want countries to use this data for informing decision-making. So, of course, we know integrated surveillance. We know integrated surveillance is recognized as one of the main mechanisms to support evidence in the One Health spectrum. So this is recognized, integrated surveillance in AMR, in AMU, but also integrated surveillance in humans, animals, and also the environment. So the quadripartite, we are working together in different initiatives on integrated surveillance. For example, just also to answer some of the questions our colleague was asking in the previous presentation. So we collaborate with quadripartite. We collaborate with different initiatives. For example, we have a technical advisory group on integrated surveillance that it was just established a few months ago, that they are starting to work on guidelines. But one of the initiatives that we are also coordinating with quadripartite is the Global Integrated System for Surveillance of AMR and AMU, which is called GCFA. This is the mechanism that quadripartite agencies are going to be using to gather the information coming from the different systems and the different data that are collecting. So we have, for example, GLASS, the Global Antimicrobial Resistance Surveillance System, collecting information from AMR and AMU, that is going to be sharing this information with GISA in the future. We also have the Animus platform. Our colleague Nahoko was explaining also on the Animus platform, is collecting antimicrobial use in terrestrial and aquatic animals. And this information is also going to be gathered under this GISA platform. And under the responsibility of FAO, we have antimicrobial resistance in animals and food, and antimicrobial use in plant production and protection. And this is what we are going to be collecting through the International FAO Antimicrobial Resistance Monitoring Data Platform, the INFARM. So this is it was explained the last year also, but I'm just going to briefly explain. This is the visual identity of INFARM. In the left, we have the data generation. So we have the bacilli and the cocci, the bacteria, that are isolated. Yeah, something is not, yeah. In the left, we have the bacteria, that is the data generation part. In the center, we have the capacity building for transforming this data in information. So we want to transform data in information that is shared at different levels, and this is what we also want to represent in the right side. So INFARM is designed to support countries in collecting, analyzing, and using their data, but it's also designed to support countries that want also to share this information at the global level and want to share this information at the global level in the FAO platform, but also in the GISA platform. And this is what we will be supporting for countries. So when we talk about surveillance in food and agriculture, we always have different objectives. No? So we always talk about the public health objective. We also talk about the animal health objective. So these are the main objectives that we are doing that we have for antimicrobial resistance surveillance in food and agriculture. The one that we are going to be putting more attention and putting more focus initially, and the immediate priority, is to collect antimicrobial resistance data from foodborne bacterial pathogens and indicator bacteria. But the platform is designed to gather and to collect information from all different surveillance programs, also from the animal pathogens and from for animal health. So this is the main focus because, of course, this is also supporting the implementation of the Codex guidelines for integrated monitoring and surveillance of foodborne AMR. So understanding that countries have different levels of development of the, it moves alone, sorry for that, there must be a technical glitch, but it moves alone. So understanding that countries have different levels of development and implementation of their surveillance activities. There are countries that have national surveillance systems in place. There are countries that are just starting in some initiatives, like, for example, Myo Singh was talking about Mongolia. They are doing this small pilot study. So understanding we have different levels, the platform is designed to collect information from both systematic monitoring and surveillance, but also from pilot monitoring activities. So the data is going to be tagged accordingly so that it's not mixed and analyzed together, but we are going to be collecting information also from these pilot surveillance activities. Then the platform is going to also be able to collect information on the context, information on reports, for example, the implementation of assessment reports, and also we have a questionnaire also to collect information on the different surveillance elements, different surveillance components in food and agriculture that is giving us an understanding of how this data was generated. Then in the center, we have the data collection, analysis, visualization, and interpretation. Countries are supported for these 4 functions, and countries can do this accessing to the private interface. There will be a private interface with restricted access in which countries can log in and look at their data, look at different interactive data visualizations, the dashboards that we are finalizing the development right now. And this is going to be migrated on an annual basis. There will be an annual publication cycle like there is in GLASS, like there is in other surveillance systems in AMR, this data will be migrated from countries that allow to share this data at the public level, will be migrated to a global public interface. So just to give you some idea of the type of reports we are developing in the platform, we have reports that are produced automatically in 24 hours after the countries submit the antimicrobial susceptibility testing results from the lab in the INFARM AMR data files. We have reports that show the country profiles, so the volumes of data in the different bacterial species per specimen, also where the samples were recovered, also the type of surveillance program or objective and scales of monitoring. All the dashboards have in the right always different filtering options, of course, because the filtering options are essential to understand and to interpret the data. So this is another type of dashboard, which is showing also the volume of isolates submitted in the system for different bacterial species according to the specimen, origin, etc. And this can also be filtered by year, scale of monitoring, interpretation criteria, etc., etc. Another example is the antimicrobial resistance prevalence, or the proportions of antimicrobial resistance to a specific given antibiotic panel. Here you can also filter by bacterial species, and you can also filter by interpretation criteria, etc., so that you cannot make misinterpretations. We also have analysis of trends. There will be a possibility to analyze the trends on resistance if countries want to monitor the progress in their interventions. If they are, for example, placing a ban on the use of a specific antibiotic, they can see if it's being efficient or not. And we also have multi-resistance proportions available in the platform. that will be also having a longitudinal analysis per year. We are working now, finalizing the development. So as Miriam Singh was saying, we finalized the development of the beta version of the InFarm platform. And we are finalizing, with the feedback we receive from countries through the piloting phase, we are finalizing the final IT solution. In the final IT solution, we will include more dashboards. So far, we have 9 different types of dashboards with maps as well, maps with different color and different shades of color depending on the prevalence. We will also be adding a new dashboard on the distribution of minimal inhibitory concentrations, MICs, in tables, but also in graphs for countries that are using this methodology for antimicrobial susceptibility testing. So just some of the benefits for countries. So this is a safe place to store data with restricted access and possibility to share it at different levels of confidentiality. These are easy tools to analyze and interpret data. This is one of the main gaps we identified through many assessment missions we did in countries, is that countries produce data. Countries produce data even through pilot studies, but also through systematic surveillance, but they are not using this data. They might have like tons of Excel files and tons of data, but they are not using it for anything because they don't even, or maybe they don't have epidemiological capacities, or maybe they don't know how to do with this data, how to interpret. So we hope this new platform will also help countries to analyze, interpret, at least to produce some of the reports. Of course, this will never substitute a full epidemiological analysis of your information, but at least this is is a first step for starting to use the data. Then it will also be a one-stop shop with repository of documents, information to contextualize the data, as I was saying before, and it will improve coordination in data collection, analysis, and harmonization in data generation. And I will explain a little bit more on that later, because there will be also a figure showing how the data is integrated across the food chain and coming also from different institutions. So this is hopefully going to be one of the solutions also for countries to share data between ministries, between different agencies. This might break some walls, I think. Then also will contribute, of course, to the global One Health AMR surveillance efforts. So just to show you the roadmap. So in 2022, we finalized the development of the beta version of the platform. Then we, in beginning of 2023, for 4 months this year, from January to April, we were having a pilot phase with countries that expressed their interest to participate. They were sending information on their surveillance systems, but also they were submitting antimicrobial resistance data to the platform. They provided extensive feedback in the use of the application. With this feedback, what we are doing now is to integrate it in a final IT solution. And so this is what we are doing now, expanding the functionalities of the platform. At the same time, we are developing guidance materials that will help countries to participate in the initiative. And in parallel, we are also building the interoperability with HUNET and other laboratory information management systems. This is very important because the management of the data, the cleaning, validation, management of the data is a step that we know is going to be a bottleneck for many countries. We want to facilitate the transmission of data from the laboratories to the platform directly. So, and this is going to be facilitated, like it's done for GLASS with HUNET, is going to be also facilitated for InFarm with this data management software. In 2024, beginning of 2024, we plan to launch first annual open call for data. We plan to start the global rollout of the initiative. Then, of course, there will be the publication of guidance materials. We will couple this with trainings in data management, trainings in HUNET, trainings in laboratory information management systems that are adapted to produce ready-to-send InFarm AMR data files. And then we will also couple this with additional IT resources. 2025, we expect this is the phase of expansion with the first global report published already, maybe in 2024, but might be in 2025 because things are sometimes slower. Then there will be a second annual open call for data on an annual basis, and we will start the cycle of annual data production, and then integration with other data platforms. This is also very important because as we are talking always about integrated surveillance, it will be important to start conversations with other agencies to see how we can do not just putting data in a global repository in GISA, but also how to start doing integrated analysis. So analysis like the one that was shown at the European level, for example, from Ernesto, from the GIACRA reports, the joint reports from the different agencies. 2026, phase of consolidation. We expect the annual open calls continue, but we also expect to expand to other programs of surveillance. We were discussing in the session before about whole genome sequencing, about next generation sequencing technologies. We understand this might be the future also for surveillance. We need to also start thinking on how to integrate this data also as part of the INFAM system. And of course, also antimicrobial use in crops. This is something that we are already starting collaborations, and we are starting also to expand knowledge on that, to understand what are the sources of information we can use to start producing some data on the volumes of antimicrobial use in plant production and protection. So as I said before, launching the open call for data, we need to produce guidance materials. When we talk about guidance materials, there are different levels of practical details we can give. So the codex texts and the guidelines on integrated monitoring and surveillance are giving ingredients, but it's like the book of ingredients, but sometimes you don't know how to use these ingredients to make the recipe. So these are the texts, how to implement it practically. There are different guidelines, for example, in Asia Pacific, but in other regions, that are supporting the implementation of specific surveillance programs. Surveillance programs in healthy animals, in diseased animals. These guidelines are very useful for supporting the specific programs and are giving more details on, for example, how to calculate a sample size, what are the sites for collection of samples. They are giving more practical details. Then we also have protocols for implementation of integrated surveillance at a higher level of detail, like the tricycle protocol from WHO. And in the middle of this, at the level of detail that is between the ingredients, but also between the guidelines, we will have the manual for operationalization of INFARM and how it contributes to integrated surveillance. In this manual that is in preparation, we are including a framework for harmonization of the data collection, framework explaining the different surveillance programs in food and agriculture, giving some recommendations for which interpretation criteria to be used, which antibiotics to be tested for the different bacteria. We are also going to give some of the steps for participation in the INFARM initiative. So how to participate in INFARM, and just a very quick summary of some of the things we are including already in the manual. So to participate in INFARM, we have defined 3 simple but complicated steps. So it depends on how you look at that. So the first step is to identify the AMR surveillance components in agri-food systems. So we know that many countries are doing antimicrobial resistance surveillance activities, but they don't identify the different components across different ministries or across different institutions. So we want to set this as the first step for specific surveillance programs, but also for countries to start thinking about how to integrate these different surveillance programs. The step 2 is to identify the national INFAM focal points and start reporting. And countries report on 2 things. Countries report on the status of AMR surveillance in agri-food systems. So they have a questionnaire on the main components of surveillance systems, and then also reporting on antimicrobial susceptibility testing results from the laboratory, so AMR data. Then the step 3 is to commit to gradually establish the national AMR surveillance in agri-food systems that can gather and communicate on a regular basis information into the platform. And I'm going just to dive in some of these steps. So in the first step is to identify AMR surveillance components in agri-food systems. And when we talk about these different components, we have different surveillance sites. We have farms, we have slaughterhouses, we have places where the food is sold. So we have different, we also have diagnostic laboratories doing diagnostic of diseases in animals for animal health. So, and these might fall into different ministries, Ministry of Agriculture, Food Safety Authorities, Ministry of Health. So it's important that countries know what is going on in their country and what can also be designed in their country. So we have defined 3 main elements of let's say this is a national surveillance network, an ideal national surveillance network, but there might be different models. There might be different models of a surveillance network depending on the country. So the 3 elements of a surveillance network are the peripheral laboratories. So these are laboratories processing samples from the different surveillance sites, isolating the bacteria, and sometimes doing antimicrobial susceptibility testing, but not always. Sometimes these are the peripheral laboratories that are producing the volume of samples that are then sent to the reference laboratory. The reference laboratory is responsible in many cases for antimicrobial susceptibility testing, for confirmation of the results, validation and standardization of methods and results, and also the external quality assurance proficiency testing to ensure the quality of the antimicrobial susceptibility testing in the laboratories. Then we also have the National Coordination Center, responsible for coordination of surveillance activities in agri-food systems, the development of national surveillance programs, defining the objectives and designing epidemiological protocols, and also responsible for the dissemination of the information that can be externally through annual reports, but can also be internal through bulletins, or also sharing the results with the different stakeholders. So this would be an ideal network, so countries can identify which of the elements are in place. Sometimes countries have more elements than they think. When you go on missions, for example, for the assessment tool for laboratories and surveillance systems, we go on missions to countries, we realize that in the discussions with the different stakeholders that they have more things that they thought, or at least they have things in an embryonic stage. So they might have already some pilot activities or even research activities at the university. So this might be something that countries can start building on. Then the second step is to identify national infant focal points and start reporting. So the first thing is to identify the infant focal points. And an infant focal point are defined as in the slide. So these are nominated in coordination with the national bodies overseeing the development and implementation of AMR surveillance and monitoring in food and agriculture. And these are ideally experts with knowledge and experience in epidemiology and data management of antimicrobial susceptibility testing results. There can be one single infant focal point per country. This is a situation that we found in some countries where they have maybe just one surveillance program in place, but there can also be several infant focal points nominated for each of the specific surveillance programs. And when we talk about surveillance programs in food and agriculture, we divide it in 5. I'm going to explain later in more detail, but we have healthy terrestrial animals, diseased terrestrial animals, healthy aquatic animals, diseased aquatic animals, and food commodities. These are the 5 main programs that a country can define for surveillance. And in many cases, there might be several focal points responsible for reporting these different pieces of data on an annual basis. So the minimum requirement to participate is, of course, to enroll in the platform. The countries have an enrollment questionnaire. They send the enrollment questionnaire with the identification of the focal points. And once this is done, the first thing that they are asked is to complete a surveillance components and implementation questionnaire. This questionnaire is already integrated inside the platform. This is something that we received feedback that in the pilot phase. The pilot phase was a Word document, but now it's already inside the platform. Countries can complete this questionnaire. We can also get all the answers in a database for further analysis. And this surveillance components and implementation questionnaire is going to identify the main different elements of the surveillance system. It's also going to identify if they are doing a quality assurance of the samples. It's going to bring some context. It's not like a full Atlas mission, a full antimicrobial, so the tool we are using for antimicrobial resistance surveillance capacity building is not like a full Atlas mission, but it's something like a small version of the Atlas tool that can serve to identify and to contextualize the AMR data. Then countries can, the second thing countries can do, so the submission of the surveillance core component questionnaire is something mandatory for participation. And this is something, of course, that is desirable, that countries also submit antimicrobial resistance data. So this is not a requirement for participation in the initiative, but countries, of course, are going to be invited to submit antimicrobial resistance data into the platform and to submit the antimicrobial susceptibility testing results. For this, there is a data model already specified. The database is already built upon this data model that is harmonizing the data collection, the different attributes, the different codes that are recognized by the platform. And this is in Excel, but it can also be submitted in comma-separated values, different formats. And with the collaboration we are establishing now with HUNET, it can also be produced automatically for sending it to the platform. And then this is something that will help also in this process. So the process of identification of infant focal points, but also the process of reporting, the process of collating the information on an annual basis and putting it together is going to be done according to this framework. So we have developed this framework, which is relatively simple, but not always understood by all countries, in which we have different steps in the food chain, so primary production, processing, and consumption. Then we have different surveillance sites associated to these different surveillance programs. As I said, we have 5 surveillance programs, and then in these 5 surveillance programs, for example, if we focus on the left side, this is for the purpose of animal health. We have the diseased terrestrial animals and the diseased aquatic animals. This is basically coming from veterinary diagnostic laboratories that collect samples from diseased animals, from bacterial infections in animals, different specimens, and different animal pathogens in these animals for this specific program, the specific program of diseased animals. Then for the healthy terrestrial animals, and for the healthy aquatic animals and the environment, and for food, we have common indicators that are defined universally. The common indicators, the commensal indicators, Escherichia coli, Enterococcus, but then also the foodborne pathogens in terrestrial and in aquatic animals. And these are common for all the, for the public health objective, of course, and for these different surveillance programs that I was talking before, so for the food commodities, but also for healthy terrestrial and aquatic animals. As you can see, this is covering the whole food chain, and is covering the different steps in the food chain, also the post-mortem stages. And this is important so that countries understand what is the type of data, the type of information that is going to be collected through the platform. And of course, this has an impact also in the nomination of infant focal points. And I'm just going to show you 3 different scenarios that we identified through the pilot phase. Through the pilot phase, we identified that sometimes we have one focal point covering all the antemortem phase, so covering all the live animals programs coming from the Ministry of Agriculture. This focal point is responsible for submitting information from diseased animals, but also from healthy animals. And then one coming from the food side, coming from Ministry of Health, in many cases, or food safety authorities. This is one scenario, but we also have other scenarios in which Ministry of Agriculture is responsible for everything that happens until consumption. Then consumption is just under Ministry of Health in some countries, and they can report data, for example, passive surveillance in foodborne outbreaks. This might be something that they can also report on the platform in Salmonella and Campylobacter, for example. Other situation is a complete separation in the side of veterinary diagnostic laboratories in the diseased animals. So we have many diagnostic laboratories that are responsible or separated from the healthy animals, from the healthy aquatic animals and the active surveillance programs. So basically all the diseased aquatic and terrestrial animals, this is mostly done through passive surveillance in clinical samples. And on all the right side is mostly done through active surveillance, except the programs for foodborne outbreaks in consumption. So to report the data, to report the AMR data, understanding this framework for surveillance, countries at the infant focal points are responsible to put all the data together in in-farm AMR data files. And what is an AMR data file? What defines this entity? This entity is defined by these 3 attributes. So it's an in-farm data file is defined by the combination of these 3 attributes, so year of sample collection, level of representativeness of the data, and the surveillance program that we were talking about before. So, for example, one in-farm data file would be from year 2022, from a pilot surveillance activity that is representative only at the local level, so it's not having a representative sampling scheme, and from healthy terrestrial animals for public health purpose. This could be one single in-farm data file. The countries are responsible for putting these different data files, and then they can decide on 2 things. They can decide to report through different model options, option A and option B. Option B is reporting antimicrobial susceptibility testing results at the isolate level, disaggregated, And option B is reporting it aggregated, like they do also for glass right now. Then countries can decide on the level of confidentiality of this information gathered from this specific file. And there are 3 levels of confidentiality. I'm going to explain them now. So the first level is to keep the information private, only for the country. So countries are going to share the data into the private interface. They will access the interactive data visualizations just for their own. And then there are 2 public levels that countries can decide to share this information. The public level 2 is aggregated, so countries agree on sharing this information in the private interface. But on an annual basis, we will migrate all this information to the public interface, but without showing the country identity. So we are going to make the country identity blind so that we can also show the information. This is something like WOHA is doing now at the regional level with the Animuse platform. And then the public level 3, which is the most desirable one, the one that is used in many countries, but also in the European Union. This is the one that they are using also in glass, is used this level of confidentiality. So countries share the data into the private interface. They get access to their own data visualizations. But then on an annual basis, we will migrate all this data to a public interface, also showing the country identity. And of course, this is the one that we have established this hybrid modality of levels of confidentiality, also with the hope that countries gradually move towards level 3. And yeah, this is something that we will need to work over the years on how to do that. Then something that is important also in this step 2, when we need to report data, as I was saying before, is one of the bottlenecks is to manage and clean and validate this data. And we have now just signed an LOA, a letter of agreement with HUNET developers, and they are going to work on the interoperability of Infarm according to our data model, and also they are going to develop their tutorials and their trainings for exporting data to the Infarm platform. So this is very important because it will be the mechanism that many countries will be using for managing the data to submit to the platform without doing all this manipulation of data in Excel files. So hopefully this can solve some of these bottlenecks. Then we go to step 3. So we identified the surveillance components in step 1. We then identified the focal points. We started submitting information on surveillance, but also antimicrobial resistance data. And now the step 3 is to commit to gradually establish this AMR surveillance in agri-food systems. And for this, FAO has the assessment tool for laboratories and antimicrobial resistance surveillance systems. The FAO Atlas is quite a mature tool already that has been deployed in more than 55 countries and 200 laboratories. We have community of assessors in Asia, Africa, and Latin America, and it's a tool that is helping countries to prioritize actions to move to progressively improve their capacities for laboratories, but also for the surveillance systems. So the tool is giving a stage from 1 to 5 to the capacity of the laboratories to do antimicrobial susceptibility testing and bacterial isolation, but it's also giving a stage between 1 and 5 for the whole surveillance network. So according to this, the next step, and this is what we are initiating now with our information technology division, is to digitalize Atlas. Atlas has been a tool that has been always Excel-based. Excel tools are very difficult to use, are also very difficult to analyze. Many countries and many stakeholders are always asking, where is the Atlas tool? Is it published? Of course, we can publish an Excel file, but in the end, the use is not going to be the best if we just publish a very, very long questionnaire in Excel. So what we want to do is to digitalize and to provide access through a digital solution that will create automatic visualizations, but at the same time, will also give us the opportunity to have all this data in a database that we can analyze and that we can also produce information. Of course, Atlas is a quality check for data in the end. So countries receiving stage number 3 in their data generation network, but also in the surveillance network, we can rely on this information. We can say this information is more reliable than a country at level 1. And of course, this is also very relevant for the platform because it will be the quality check for the data we receive into the system. And just to close, so FAO is contributing to surveillance and monitoring in all these different steps. So we are providing support to countries in the overarching design, so countries to design their national surveillance programs, but also we are supporting countries in the data generation and management of the data now with this HUNET letter of agreement just signed. We are also supporting countries now with the Inform Data Platform for the analysis. And in the left side, we have all the production of data. But the most important thing is to transform this data into information. Transform in information, in findings, evidence that is supporting policy recommendations to support all the different interventions that we can do in the fight against AMR. And with this, I would like to close the presentation. Thank you very much.
Thank you, Alejandro. Actually, we are quite behind of the schedule. However, I'd like to invite any comment and question. Okay.
Thank you very much, Alejandro, for an excellent presentation. You have all my admiration. I cannot even imagine how difficult it must be to bring all this together, knowing how difficult it is only in Europe. Maybe one comment there. You showed this letter of, or this memorandum of understanding with HUNET, but perhaps one of the obstacles that you will have is those countries that are already collecting data and reporting data to other databases. So have you thought not only about this particular link, but how to provide help to those that need to convert their data models to feed your system? Because if a country needs to report to 3 or 4 different places, I think it will be quite a challenging thing. That's the first comment. And then a question. Have you done any kind of pre-starting questionnaire about these confidentiality levels and how many countries are already prepared from the beginning to go to level 3? Thank you.
Thank you, Ernesto. Very good questions, because on the first one, on how to support countries that already have national surveillance systems in place, high volumes of data, like the European Union, like the US, like Canada, like many other countries that have public data in different repositories. This is something that we need to think further. We think that HUNET is going to solve part of the problem because many countries are already using HUNET. But I think in the specific case of the European Union, we might need to go through memorandum of understanding with these members specifically, because I understand now EFSA is collecting information from individual countries, and then you share this information to the European Union as an agency. But of course, we can go country by country, but it would be more efficient just to do it through EFSA, for example. So countries have an agreement that if everything they share with EFSA will be collated together in EFSA and will be shared commonly into the platform. So this is something that we could discuss, and this is something that would be super interesting, because I think the European Union would be could be also a beneficiary, because in the end, all countries are going to be able to see the different prevalence levels and to make comparisons, not for the bad purpose, but for the good one, for the purpose of advancing together. With other countries, we know that the adaptation of the data models is not that difficult. For example, Canada, and I can say this publicly because Canada was one of the countries that was also has public data. All the data is public in the CPARS program. They were also sharing the data in the platform, and it just requires, of course, someone, an epidemiologist, doing the transferability of the different codes and the different attributes. Of course, it takes some work, but once the code and the syntax is written, this is something that just needs to be run on an annual basis. Of course, yeah, it's a barrier. Yes.
Thank you.
Yeah.
Okay,
and well, maybe for the second one, the second one was if we have an indication of which countries are going to be sharing at which level. Right now, we don't have this indication. We have the indication that countries that already have public reports will be happy to be at level 3, of course. Yeah, but in low middle income countries that are just producing initial data, we don't have an indication. And I think this will come in the global rollout. Yeah.
Okay, I want to invite Nako. In your OI experience, do you have any recommendation, suggestion to establish Inform that program? The microphone.
No, I actually had a very specific and practical question. How are you going to manage the access to this platform by the countries? Because especially when you expect that multiple people would access from one country, and when these people are not affiliated to the ministry directly, so that, practically speaking, for example, sorry, because I know the faces of those who may access to this in this region, right? So, for example, some laboratories, experts, not affiliated directly, and when they are handing over their roles, responsibility to their successors, etc., we can imagine all this would happen soon after you roll out the database. And I wonder, or probably because we are in a very similar situation as I just said. So maybe we can exchange those practical, experiences and questions together to really run the database effectively together.
Yeah. No, that's a very good point, and thank you for raising this question because it's one of the key points. We have regular conversations with WOHA, so we've been discussing many times also with WOHA headquarters colleagues on their experiences. And in the end, the main solution here is to nominate official focal points. So that's why the nomination and the access we provide to the platform is going through ministries. So when we invite countries to participate and we will launch the global rollout, we will invite ministries of agriculture, ministries of health, and food safety authorities. So we will need to reach all these channels. And it will be the ministries that need to nominate the focal point. Of course, they should not nominate 20 focal points from the laboratories. In the end, the idea is that the platform is for national and government use in the end. So it's not for laboratory personnel on a specific surveillance program, because what we want is to collate this information from the different laboratories in one single place.
Yeah. Thank you. Okay, one more question. Then we'll close to move next presentation.
Thank you. It's a comment and also to share the experience. I think that we need to talk in the quadripartite, right? Because we have the same experience with glass. And exactly for the European region, we have an agreement with the ECDC because they are also publishing that. So we get the information that is published in glass through ECDC. So from the European regional office, we get the information. This is one. The second one, this is question, it's important to also think about the quality of the data that you are going to receive, because the countries can be interested and they are collecting data, but we talk about the quality of the laboratory susceptibility testing, right? You can receive many salmonellas with high resistance of carbapenems, and basically it's because the antimicrobial disk is not working. So something like that, I think that you need to consider, because it's a lot of information that you are going to receive. And the last one, we were discussing the last point. Okay, so we will talk later. But congratulations, because I think that is really good initiative, and it's the one that we need to finally have information from the different sectors on AMR.
Yeah.
Okay. Yeah, it's about the focal points. The focal points also, we have an agreement with the countries, and they designate in the case of glass, from the Ministry of Health. But I understand that. But it's also important, I mentioned in my presentation, the AMR committees, the national AMR committees, because it's where all the different ministries are working together on AMR. So I think that is the place to decide who is going to deal with the data from each sector, or one focal point for all the data.
He mentioned about that the National Coordination Center is important to validate all the data, to transfer that, different countries, to make a national action plan, followed by regional, and then finally global action plan. Thank you very much.